A 27-year-old patient that was in the original study had it done 14 months ago, and the patient originally was in the study because he could not take finasteride due to side effects. So we stimulated and injected the platelet-rich plasma into the crown area, and he noticed the first change of thickening of his hair at 4 months. That really goes along with what we saw in the study. And he also noticed the change reverting back and miniaturizing at 11 months. So it is now 14 months. This is his hair today at 14 months. He did notice a thinning of the hair at about 11 months. And so today what we're going to do is we're going to stimulate and inject the platelet-rich plasma with a protein matrix or Origin Plus. But you can see this was his hair. There's it seems to be miniaturizing a little more on the peripheria. In the original pictures, it seemed like on the right-hand side here it was definitely thinner, but it's overall again it seemed to thin at 11 months, got thicker from 4 to 8 months was the peak period, and then started to miniaturize at 11. So here we have the processing machine, and today we're using the Genesis machine, and we have now processed from 60 cc's of whole blood. We've now processed 10 cc's of platelet-rich plasma, and this is platelet-rich plasma with a protein matrix or Origin Plus, which would be the second generation of platelet-rich plasma. And we'll go into the room and treat our patient. What we're going to do, since we've anesthetized your top, we're going to stimulate it with a microneedling roller, and then we'll inject the platelet-rich plasma, and you'll just keep the platelets on overnight and just shampoo your hair in the morning. You can go back to work today, or you, like you said, you want to go to the gym, that's fine. There's not a problem. We just don't want you to shampoo your head today. You're just going to start to stimulate the area and just gently traumatize and cause some stimulation for the follicular stem cells to actually go into an early, try to stimulate them into an early growing phase. And we'll just go back and forth a few times. Keep going. So we'll now stimulate the area with a microneedling roller. This particular roller is made by Clinical Resolutions in Beverly Hills. It's a 1 millimeter roller, and we'll gently stimulate the scalp. And what we're trying to do is to have the follicular stem cells basically go into an early growth phase. After stimulation, we will go ahead and inject the platelet-rich plasma or Origin Plus platelet-rich plasma with protein matrix. So after stimulation, we'll just inject the PRP, Origin Plus, about every ½ inch, and you will get platelet migration throughout the area. And it's a very simple, easy procedure for both patients and us. It takes about 35 minutes. And the beauty of it is it's very safe because it's all the patient's own cells. We're injecting the PRP mainly into the dermis, and keeping it on the surface of the scalp overnight. As soon as we inject the PRP with matrix, we'll activate with thrombin. And we're almost done. We want to get all the different areas. And spray some of the platelets on. And now the thrombin. Activate the platelets. We found that activating the platelets reduces one of the growth factors that has a inhibitory effect, and we can reduce that up to 60% by just activating the platelets. And the cumulative effect is that hopefully we'll get the same result that we had the first time. So you can see just basically this is the platelets and just a little bit of erythrocytes on the scalp, and everything is now being activated. We kind of massage it into the area, and he can go to the gym, go home, go back to work. Even though it looks a little bit red, the procedure is very very benign, and we'll follow up with him probably in 6 months and check his progress. And like I said, initially he was in the original study, felt that he saw an improvement at 4 months up to about 11 months, and then he started to see the reversing and miniaturization of the hair getting a little bit thinner. He's now at 14 months, and this is only his second session.